Hello and welcome, everyone. I'm Dr. Tom Chaney. This is Living Health Live. Joining me on the show, as well as in light and in our practice, Living Health Integrative Medicine, is my wife, Dr. Steph Chaney. We are your trusted source for the latest information to help you get and stay healthy naturally. We're super excited to be joining you regularly to take you on an adventure of a lifetime, your lifetime of great health. You're going to get some great information, strategies, and the latest research on how to live a better and healthier life. Just remember that the information on this show is intended as educational information only. Information given here is designed to help you make informed decisions about your health. It is not intended as a substitute for medical treatment. On today's episode, we're going to discuss a root cause approach to type 2 diabetes. We're going to do a deep dive into type 2 diabetes, but not just the symptoms. We want to uncover the root causes from a functional medicine perspective. So we've helped thousands of patients reverse type 2 diabetes. Our goal is to help millions reverse it, which is why we wrote the book, Defeat Diabetes, which we put in Defeat Diabetes, some strategies that we use every day to help patients in our office. So first I want to talk about, and I mentioned functional medicine, the functional medicine approach versus conventional medicine. Let's just get into the different approaches when it comes to type 2 diabetes specifically.
Well, conventional medical approach is to give medication to a patient to try to either stimulate the pancreas to produce more insulin or to stimulate the kidneys to release more sugar from the bloodstream. So you're going to pee the sugar out in a higher amount. The idea is to lower the blood sugar with a medication that alters the body's function. But what they're not doing is addressing what's causing the sugars to be high in the first place. Other than sometimes to make insinuations that it's hereditary, like somehow you're genetically made to be diabetic, which is completely false. It's much more related to lifestyle. There's no way that half the population right now is diabetic or pre-diabetic if that's genetic. It's like
Right.
God did not design us all to be diabetes. The functional approach is to look at the entire body, all the parts, versus how conventional is set up with all the specialists. You've got the cardio and the endo and the primary and the nephrologists and the neurologists, and nobody's talking to each other. Nobody's coordinated. Everyone's throwing medication at the patient, just trying to handle symptoms. Sugar is just a symptom of something going on. Whereas a functional approach or a holistic whole body approach is to just look at where is the body dysfunctioning and how do we then get the body balanced? Because when the body's in balance, then it will function optimally, including not be diabetic, essentially.
And I think we also have to just discuss just for a second and just remind everyone is that the body heals itself. So it's not these medications that heal the body. They're putting Band-Aids on these problems.
They also cause a million other side effects.
Exactly. So they do cause side effects. And if we're not addressing the causes of the condition, whether it's diabetes or hypertension or high cholesterol, the condition is going to get worse because there's going to be more organ and gland dysfunction in the body, which is what we're going to talk about. And first, I want to get into the scale of severity because I find a lot of patients come in and they have been told by their doctor, and their doctor almost minimizes this condition. And I want to just like whole picture, big picture, go through the different phases of pre-diabetes and type 2 diabetes. And as we're going through it, for the listeners, I want you to start identifying where you're at. And then once you know where you're at, then you can start to develop a plan to actually reverse it and improve. Ideally, we're at phase zero, which is healthy blood sugar. So we see that healthy blood sugar, fasting glucose is anywhere between 80 and 100. Non-diabetic A1C is below 5.7%. And a lot of research is supporting even lower than that if you're looking at longevity and anti-aging. So that's where we want to be. Now, what typically happens first, this is phase 1 or 2, we get an elevation of blood sugar following meals. But most patients, they don't even know this is happening, right? It's just is happening underneath the hood and you're going about your day. You don't really have any symptoms. So what happens next is insulin resistance. And so that's when your blood sugar glucose starts to stay at 100 to 126. And what is insulin resistance?
Basically, your insulin receptors become damaged or shut down. Like the cell doesn't need sugar because it's got an excess or good amount of it, or the receptors are just all used up versus how much is in circulation. So if sugars are really high, your body will produce more insulin to try to get sugar into tissues. And then what's crazy is that the first organ to become insulin resistant before anything else is the liver. And then the second major organ is muscle, but your fat is not, it's sensitive for longer. And you will, if you can't get sugar into muscle, then your body will convert it into fat and stuff it into your fat cells. A sign of insulin resistance is getting fatty, losing muscle tone, muscle mass. Sometimes the person's weight stays the same, but their tissue ratios change. And so it may not even be something that they're aware of.
And that goes into phase 4 to 5. So as you mentioned, lipids start to become abnormal. So maybe triglycerides go up, and we call that metabolic syndrome. A1C typically goes up as well.
Yeah.
Anywhere between 5.7 and 6.4%.
So this is your pre-diabetes. So at that mid-range category 4 to 5, that's pre-diabetes.
Right. They tell you pre-diabetic, you're borderline diabetic, go change your diet, go lose weight, go exercise. You could try all those things, and maybe they put you on a cholesterol lowering medication at this point as well. But what typically happens is things get worse because we didn't fix the insulin resistance. We didn't fix any of the other dysfunction that we're going to discuss. So A1C goes up above 6.4%. That's when you're diagnosed as a type 2 diabetic. Now, if you're just put on medication and we don't actually handle the root cause like we're going to talk about today, then we start to get an elevation in glucose, A1C goes up, and we have something called advanced glycation end products, which start to build up in the body. These are very damaging to the body. We call them ages because they accelerate aging in the body and degeneration in the body. And that's why diabetes, it affects every organ, every gland in the body, every part of the body.
Right.
It just accelerates aging.
And hemoglobin A1C is the percentage of red blood cells that are essentially damaged by, more often than not, blood sugar. Then it's these AGEs there. It's like sugar. Just think of it. It's very sticky, right? Sugar is like syrup. It's sticky and tacky. And so it starts to stick to platelets and blood cells and proteins. And then you got sticky stuff sticking to sticky stuff. And now you have red blood cells that get damaged because of that. And so they're not able to carry oxygen. You have damaged hemoglobin, you have damaged red blood cells, you can't carry oxygen as well. And that's what that is a sign of, an overabundance of that toxic material.
And if that persists for too long, then you start to progress even further, go down the scale to 8 to 9. And that's when you have type 2 diabetes with tissue damage. So these are the patients coming in that tell me that they have neuropathy, so nerve damage. They're starting to get sensations in their feet and maybe even in their hands, or they have kidney issues, or they have a history of heart issues, heart attack, stroke.
Or the eye stuff, the retinopathy, the vision changes, the macular degeneration, glaucoma.
So you can see that once you start getting those symptoms, you're already at the bottom end of the scale. And if that doesn't get corrected, that's when you go into the final stage. And that's when we see patients coming in that are in this stage. They're on dialysis. They've had amputations. They're facing cognitive decline at an early age. Kidneys are failing, the decreased lifespan. These are all the consequences of not addressing root causes and actually just treating symptoms.
And these are permanent changes. So 8, 9, 10 is where you see sometimes permanent change. So even if a patient comes to us to help them reverse their diabetes, we may be burdened with the dysfunction of some major organs and glands and systems in the body that are permanently not able to function properly. So we'd probably, in some cases, depending on how, obviously if someone has their foot amputated, that's a permanent thing, right? Kidney damage, your kidneys are very delicate. Those are hard to come back from. Most of our patients are coming to us and they're in stage 8, 9. And it takes like getting into stage 8, 9 for someone to get scared enough to like really realize that they need help. But also, unfortunately, the progression from stage 6 to 8, 9 happens because the person's just put on medication and not really, again, looking for why their sugars are high. They might even make changes to their diet that are pretty common sense, cut out soda. But over time, because there's other things that can cause the sugars to be high, those never get addressed. And eventually multiple medications are added. It's not uncommon for people to come in and they're on 3 oral medications and now there's so many injectables. And I will tell you, and this is going to be another podcast, we've already done one on Ozempic. You guys need to watch it. Go back into our archives and watch it. We're going to do an update. When we started doing this 20 years ago, plus years ago, diabetes reversal, patients could come in and their hemoglobin A1C could be double-digit high, and they could be on multiple medications. And back then it was metformin, glimepiride, Januvia, glipizide. And our patients that come in now on Ozempic, Mounjaro, Rybelsus, Wegovy, they are so sick. Their organs, their bodies are shutting down. Whatever positive result they may have gotten with regards to sugars being put on those medications initially, once you're 2 years into these meds, you have lost muscle mass, you have paralysis of your gastrointestinal system, you have stomach bleeding. It is horrifying how unhealthy a person is with a lower hemoglobin A1C than what we would have seen 20 years ago on different medications. And they were so much easier to get back to health. It is unbelievable. I can't even believe they're still on the market.
Yeah, we're seeing new ones come out. You have to become familiar with all the names and talk to your doctor about the side effects.
And understand what the mechanism is of the medication you're being put on. Because the Ozempic and Wegovy, these are injectable forms. There's oral forms also. People aren't aware that it's the same type.
I just saw a new one advertised on TV. It's an oral form. You can just call up
and order it.
Get your prescription and it'll be delivered right to your home. So educate yourself and also don't minimize. So I hope you all identified where you're at on this scale. And I know doctors or providers out there, some of them they don't emphasize the importance. Some of them do. Just addressing root causes is important. So we're going to talk about that. Let's get into some of the root causes. I actually want to start at the bottom, and because some of you listening, you've probably been told that you have this disease. If you asked your provider, why do you have this disease? You may have been told that it's because your pancreas isn't producing enough insulin. And that's a common response that I hear. So let's talk about that. Let's talk about what the pancreas does and just elaborate on that.
Yeah, the pancreas does produce insulin. And most of the time we're checking, so we check on protein with a lot of our diabetics, especially anybody on insulin. So many type 2s are also put on insulin, which is also something that in the long run will worsen insulin resistance. But more often than not, the body's not just producing enough insulin, it's producing too much insulin in a type 2 insulin resistant. So the pancreas is having to try to blood more and more, and that results in insulin resistance downstream. Insulin in a high amount is actually toxic. It contributes to cancer and blood vessel damage and more insulin resistance and weight gain, fat gain in particular. So it's usually not a pancreas problem. It's what is causing your sugars to be high in the first place. It's not addressed. So again, if you've got something causing or many things causing blood sugars to be high and your pancreas is producing insulin and then you put on a medication that just drives the pancreas to produce more insulin, you're just contributing to more insulin resistance, which makes the sugars go high. So long-term, not a good solution. Some of these, all the medications may provide a result for the first year or so, but you've got to work on the causes of the sugars being high.
So the question you want to ask your doctor, the doctor tells you that the pancreas is not functioning. You want to ask the doctor about the test that they ran to check your pancreas so you can actually see the data on that, right?
Yeah. So tests are asked for the fasting insulin, autoimmune markers. C-peptide is the protein that we run. It's basically the protein that's stuck to insulin when it comes out of the pancreas. So it should be in a 1-to-1 ratio roughly with fasting insulin. We run that as a fasting marker. And it's a way for us to know if the pancreas is producing or not. That's how we determine if a person's actually a type 1 diabetic, because later in life, you can be insulin dependent. That is where it is a pancreas problem. And that is type 1 autoimmune, which can happen not just in children, but also in adults. It can be triggered by a vaccine, flu vaccine, one of the side effects, a virus, like an infection, anything that can trip a person into autoimmunity can cause the person to start destroying the insulin producing cells of the pancreas. Then that's a different thing but most diabetics are not. That is a whole different disease. But once again, you can see even with a type 1 diabetic, it's not a primary pancreas problem. It's an autoimmune problem. So that never really gets addressed either. Patients are just put on insulin and to try to regulate sugars, but the thing causing the autoimmune destruction is still there. And so this person still has crazy inflammation attacking other areas, including the brain, which can lead to all kinds of problems later.
So let's talk about the liver next. So you mentioned the liver earlier. You mentioned about insulin resistance. The liver is important in a lot of different functions, like detox. That's your main detox organ, one of the main ones. So let's talk about how important the liver is in regulating blood sugar.
Right. So in response to sugar, the liver will produce hormones to store sugar, right? And it deals with everything. It is the first thing to become insulin resistant. And the body will be stimulated to start putting sugar into fat, which means increasing triglycerides. That's why triglycerides in the blood is a sign of insulin resistance and diabetes. And so the number one cause of fatty liver disease is not alcoholism. It's actually diabetes. It's sugar, elevated sugar. And once that liver becomes fatty, then it's not able to do its job, which is to process some of the most toxic bio waste to be expelled through the body through bile or through the urine. And so if the liver is not able to do that, then toxins will build up. All kinds of things will go wrong when the liver's not functioning optimally. And then if your liver is insulin resistant and it's not working right and it's becoming fatty, then you start having issues with even handling and regulating the high sugar levels. So things just start snowballing from there.
So liver is very important. Let's talk about the gut, the intestines, and I think right along with that, we can throw in the brain and pituitary gland as well.
Yeah. So gut, mouth to anus is actually, I say, outside the body. We're like a hollow tube. And you don't just want things to get in the body willy-nilly. 70% of your immune system patrols the border of your intestinal lining. Things that can disrupt the health of the intestinal lining can allow pathogens and toxins and undigested, unbroken down proteins to be entering the body and triggering the immune system to go into attack mode, which can lead to increased inflammation, autoimmune conditions. But anything that causes tissue damage and inflammation can cause sugars to go high. And the reason is because your body will try to counter the damage of the inflammation by secreting your own anti-inflammatory called cortisol, like your body's own prednisone. And cortisol will actually pull sugar out of storage and keep it elevated in the blood just as a side effect. Because cortisol is a hormone that is mainly part of your circadian rhythm, right? So melatonin is for sleep, cortisol is for awake. So cortisol should be high in the morning, melatonin low, and vice versa. So it's a cycle. But if you have tissue inflammation and your body's being infiltrated, especially through the intestines or the lung barrier by toxins and pathogens, bacteria, yeast, viruses, they get into the system, they trigger all kinds of crazy wartime inflammation response from your immune system, then you will secrete cortisol off rhythm and it will be high. And one of the things that cortisol does with just normal sleep-wake cycle is that as your 8-hour sleep fast is ending, it pulls a little sugar into the bloodstream to maintain proper brain function and cell process so the sugar is not crashing. But if your cortisol is high all the time, then you're going to have crazy jacked up sugars. The stuff that can happen in the intestine, toxins in the food, so toxic fats, toxic dyes, toxic flavors, toxic gum, carrageenan is like poison ivy to the gut.
Medications.
Yeah, medications, environmental chemicals. So glyphosate is terrible for the gut lining, can contribute to gluten reactivity and things like that. So all of that weakens the thin one cell lining of the gut. And so that can cause, it's almost like having like a skin rash, but in the gut lining. Inside skin is what your gut lining is. So parasite can cause problems. Overgrowth of yeast and fungus, and that could just be from just eating artificial sweeteners and artificial flavors and too much sugar, or you feed too much yeast, things like that. So these are all things that have to be looked at, taken into account, because if there's anything that's triggering your system, mold and mold toxins are another thing as well. You can see, we can talk about intestines as a separate thing, but ultimately it's how does what's going on in the intestines affect the immune system and then eventually the brain. And it's this web. This is the functional holistic thing you have to look at, right? So adrenal glands, this is where your cortisol is made. That's where we talk about the cortisol going off rhythm, getting affected by that. So if you have enough inflammation causing the secretion of cortisol, then you have sugars high, not because you're eating high sugar, you have sugars high because of inflammation. And then your liver is going to get more and more fatty just because of that. And the whole endocrine system, it gets completely out of whack.
Including the thyroid. So the thyroid gland right here in the front of your throat, it's going to help run your metabolism, which is going to affect your blood sugar if you're hypothyroid.
Yep. And hormones like insulin resistance in men causes testosterone to convert to estrogen, but then that worsens the insulin resistance. In women, it's the opposite. So estrogen can get converted to too much testosterone, which can then worsen the insulin resistance. So you get hormone imbalances, right? So we have men getting put on testosterone that end up gaining weight, getting fat, and their diabetes gets worse because they need to actually go after the sugars to get their balance right and then come back onto testosterone production. When you're just treating based on symptoms, all the medications for diabetes are basically just chasing the symptom of high blood sugar. Diabetes is a symptom, and it's a symptom that it's caused by imbalances. Eventually, some of the imbalances in all of these systems, these glands, organs, and systems start to then contribute to even worsening sugars. So a person could just be eating lettuce and chicken and have high sugars and be very frustrated and not understand what's happening because some of these things might be now completely out of regulation and need to be supported in a different way. They have chronic infections, parasite, hormone imbalances, all of those things have to be looked at now to help a person get their sugars down.
So you guys can see that there's this interconnection. That's why it's so important to look at it from a functional standpoint, at a whole body standpoint. Unfortunately, in conventional medicine, it's become every provider and every specialist has their little window. We have the endocrinologist, the cardiologist, the nephrologist, the rheumatologist, all these ologists, and they're not looking at the big picture. If you want to optimize your health, you have to look at how all these things are interconnected, how they're working together. Where's the dysfunction? How do we optimize function? So first thing we can look at is diet. That's one of the first steps you can take is look at your diet and nutrition. We talk about in some of our other podcasts, Dr. Steph's plate rule. We also talk about it in our book, Beat Diabetes. That's strategy 5. So you can start with that. Those are some of the action steps. And if you want more information on this approach, we actually published this paper, The Use of Personalized Functional Medicine in the Management of Type 2 Diabetes, a single center retrospective interventional pre-post study. So we had with several patients that enrolled in this study. And what we did was we wanted to see how effective our approach was. And we had 6 patients that were able to totally come off all their diabetes medication. And we had 5 that were able to come off 50% of their diabetes medications from this personalized functional medicine approach. So we're not a research institute. So I have patients ask, why isn't there more research like this? We don't have the billions of dollars that the big pharma has.
Well, our companies don't want to fund this research because that's getting them off their product.
And the other thing about this approach is that it's challenging to do because it's not cookie cutter, right?
Yeah.
In conventional medicine, it's very cookie cutter. Everyone is pretty much getting the same medication. They're getting the same approach. So a lot easier to do research that way. But when people are getting we're looking at root causes, but every diabetic is unique. It's much more challenging to do research. But this is something we wanted to put out there for you, the diabetic, and patients out there, but also for providers to enlighten them that there are other ways to help patients. Now, other resources for you, if you can pick up our book. Our book is on Amazon, Defeat Diabetes. We also put together a supplement to our book, which is Defeat Diabetes University. So you can go in and sign up for this boot camp. So we have over 40 instructional modules that goes right along with our book to help you implement everything that's in our book. So implementation is key for you getting results. All right, guys. So I hope you got some great information on today's webinar. You can also check out our website. So mylivinghealth.com, great resources there. If you're looking for supplements, high quality supplements, these are all supplements that we take personally. So livinghealthmarket.com. So we have blood sugar bundle there to help you supplement. But once again, we want to start by treating root causes. We don't want to just replace medications with supplements. We actually want to facilitate reversal by optimizing health. You can also contact our office. We have a contact us page at mylivinghealth.com. If you have any questions, leave them down below. And if you liked this content, please share it. We look forward to seeing you in the next episode. You've been listening to Living Health Live with Dr. Tom and Dr. Steph Chaney.